This is Dr. Alfred Kuo from the University of California, San Francisco and the San Francisco Veterans Affairs Healthcare System. In this video, I'll answer a few questions about our JBJS article, Antibiotic-Laden Bone Cement Use and Revision Risk After Primary Total Knee Arthroplasty in U.S. Veterans.
What led you to do this research?
I was inspired to study this topic while preparing for the American Board of Orthopedic Surgery's Maintenance of Certification examination. One of the references was the American Academy of Orthopedic Surgeons' clinical practice guidelines for the surgical management of knee osteoarthritis. Per these guidelines, there's limited evidence on this topic. However, the evidence did not support the routine use of antibiotic bone cement for knee replacements. The VA has records of the type of bone cement used for cases, so we were able to compare revision rates for patients who received antibiotic versus plain bone cement. We found lower revision rates in all-cause revisions, revisions for sepsis, as well as aseptic revisions.
Should practitioners change their practice based on your findings, and if so, how?
Practitioners should strongly consider the routine use of antibiotic bone cement for primary total knee arthroplasty. Our results are consistent with English registry data that also shows that all-cause septic and aseptic revision rates are lower with the use of antibiotic bone cement. There are some caveats to our study, including its retrospective nature, as well as the examination of only one formulation of bone cement. In addition, the veteran population has different demographic and medical characteristics compared to the general population, and our results may not be generalizable to all cohorts.
What remains the most important question unanswered by your study, and how do you hope to address it?
The use of antibiotic bone cement is justified in total knee replacement in veterans based on the lower revision rates. However, what we don't know is whether or not this practice is cost effective. The increased costs of bone cement with antibiotics must be weighed against the decreased costs with a lower revision rate. To address this issue, we are performing a cost effectiveness analysis comparing total knees performed with plain bone cement to those performed with antibiotic bone cement in our veterans.